So what brings you in then?
I'm having a lot of neck pain.
Uh-oh.
Like a lot. And I'm at work because I have a desk job.
Okay.
And it just gets progressively worse throughout the week. And then I have to, like, get up and try to get my head out of it because it gives me the biggest headache. Like, I feel like it brings all the way up here. And I feel it on this one.
Okay. Right as far as you can. Go ahead and look to the right. Okay. And then to the left. Was one side harder to do than the other?
This one.
That one? Okay. Then look back as far as you can. Any pain when you do that?
Yeah.
Where's the pain?
Here.
Is that where you feel it most of the time?
No, I feel it here most of the time.
And that's suboccipital. She's pointing right underneath her skull. Anything here?
Just pressure.
Where?
I feel it pull on the back of my leg.
And then does it decrease here?
Mm-hmm.
What if I were to pull your foot?
Yeah.
Where do you feel that?
Here.
Same spot again. Okay, so that is true sciatica, what we just did there, okay?
Mm-hmm.
That was called a leg raise, straight leg raise test.
Mm-hmm.
And that means there's a compromise down in here, and the pain is going down the back of your leg. So it means you probably have a little bit of a disc problem in your low back. It's not uncommon. The most common age for a medial disc lesion is 22.
Okay, I'm turning 22.
Okay,
Yeah.
that's the most common.
Like this?
Mm-hmm. And then I'm going to lean you away. Does that increase your pain?
I feel it pull.
Yeah. And then if I go this way?
No.
Right. That's classic medial disc lesion. It doesn't mean that it's the end of the world. It just, you're here and we need to treat it. What's up? Does that hurt?
Mm-hmm.
Is it too much?
No, I can handle it. Like, just when you were, like, doing on this side, just feeling it, I was like,
I'm rough.
yeah, no, I'd
pretty
rather
aggressive.
have you be rough.
That's it. Oh, I know. Hello. Say hello. Say goodbye. Woo. This is also part of it. Shoulders. We call it the four corners. There's
Like,
one
I can
here.
literally feel it crack. Like, not even crack, but like, boom.
Okay, that's normal. Everybody has that, but it shouldn't be painful. In theory, everybody's is. Because we all do this. Even I'm sitting here going, lower my shoulders, Brenda, you know. Oof. How long have you been in Orlando?
For about 6 years? 6, 7 years?
Oh, then
Yeah.
you've been here longer than me.
I used to live in Philly before I moved here. And then before Philly, I lived in Brazil.
Oh,
So-
were you born in Brazil?
Yeah. I moved here when I was 10.
Oh. I heard a little bit of an accent, but not enough for me to tell where you're from. I have a lot of patients from Brazil. And then relax the head, I got you. She's doing pretty good. It cleared out for the most part. She just needs a little bit of scraping. Oh, yeah. Perfect.
Oh, that feels so good.
I know. Oh, there it goes. Well, your neck moved nicely, okay?
I crack my neck all day.
Now you
But
tell
not
me.
like you, obviously.
Now she tells me. Thanks for saving it for us, then.
But not like you.
Well, it's hard to get that yourself.
Oh, yeah.
Like, I was doing a live stream yesterday. Like, how do you self-crack? How do you crack your back? How do you crack your back? I'm like, I don't. I don't crack my back. Let somebody else do it. It's impossible to do it the right way.
Well, I crack my back a lot.
Well,
So I think it's like there's been so much. Just try to relieve some of the pain and some of the pressure that I feel all the time.
you need to have some regular chiropractic care. You know, we go to school for 8 years to do this. We're really good at it. Well, we should be. Not everybody is, obviously, but
Maybe we should be.
we should be, in theory, with all that practice. People are like, how do you become a good chiropractor? I'm like, determination and listening to your patient. Let me know if anything hurts. Here we go.
I feel it when I'm going to bed to fall asleep, like I feel it on my ankles.
Any pain? Good. Reach overhead and grab the table for me.
Reach over here?
Yep, give me some counter. Wow. No, that ain't going. That one went just fine. So the sciatica, the one that has a sciatica, is looser. So that tells me that you're a little bit irritated. That some of the sciatica is irritation from moving too much motion. This side, see how that doesn't move?
Yeah.
I can't even, stuck. I can't get it. Back for me. Good. This one, I'm gonna be real careful, because if you're low back, and I'll put your head back for me. Let's push it back in. Throw your head back, let it go back. Okay, on your back. Did that hurt your low back at all?
No.
Okay. Bend. Hip, press out against my arms. Press out as much as you can. Like you're gonna press out.
Okay.
Yep. Push. More. Good. And squeeze. Perfect. And let's get these. Take a deep breath in. Okay, stuck here. Yeah, this is the low back here. That's it. Okay, too much? Okay, it's right here in your back. I know you have pain here, but this, you gotta get rid of that. That's from sitting. Or bending over, standing and being bent over. There's two reasons why T12. Yeah, this is T10 through T12 is just completely locked. People like to twist this region. I'm like, don't twist it. Go this way, straight. Back off. Anything in your low back? Is it hurting your low back?
No.
Okay.
I'm not comparing to that.
Right. I don't want it to radiate into your low back. You tell me if it is, okay? This is the leg that's bad. So sometimes we'll come up here and we find one. There it goes. Nice. There we go. It's called a piriformis release, okay? If you want your massage therapist to do it, it's called a piriformis release. There she is. I'm gonna do it with my hand first, and I'm gonna come in with the roller. How is this side?
It hurts, but not as much
as the other one. Okay.
Oh gosh.
Yeah, don't tell me that. I'm just kidding. Hey. This one's just tight. There's no nerve problem. It's just locked. So I've got to free this side up. Here we go. You okay? Is that too much?
No, it just tingles.
Tingles? Okay. Where does it tingle?
Like everywhere. Where are you doing it?
Okay.
It's like I don't know how to explain it.
Just pins.
Mm-hmm.
Pins and needles. Okay. See if we can get it to ease up.
Mm-hmm. That tickles.
Okay. Well, it's funny because as it let go, I guess that was the tickling. Okay, she doesn't like the red star. Eventually this stuff gets easier. Thank goodness you were getting massages.
Yeah.
That's it. There you go. Okay. That's it. Perfect.
So nice.
Whew. And again. Hey. All right, let's give that a break. We're gonna do the pelvis again. Hopefully that's had enough time to desensitize again, okay? Do the good side first, okay? You can come up on your elbows if you want. Would that help?
I don't know. Let's see.
Look up though. That's why I want you up on your elbows. Yeah, I don't want you to hurt your neck. Yeah, breathe for me. I don't want you, sometimes when we're down in here, we don't breathe. There you go. Down the back of the leg. Down the back of the leg. Breathe. Good, good, calf. All right, other leg. This one I can't film the skin all the way down here, so I have to do it with the roller.
Yeah, that's fine.
But your massage therapist will drape you, and she'll get in there and, you know, ask for a piriformis release. Down the back of the leg. I know. I got you. You can fight me. It's all right. Fighting me doesn't make it worse, okay? This is a massage.
Mm-hmm. Love the massage.
You can fight me, is what I'm saying. That's it. Perfect. Up the leg. Okay, here we go. It's okay if I push right here? I'm gonna push right there. My hands. See that? You gotta release these. The sciatic nerve is right there. And it loves to just cut in on that bone of the pelvis. It's like, oh, it just drags it across that bone. And it hurts. But the original problem is here. Does that make sense? Yes, you have pain down here, but the origin is here.
Okay.
So even you doing this and being up like that, you're squeezing the disc. You're making it better by doing this. You want to do some McKenzie exercises? Let me teach you some of those. So basically what you do, you're down like this. And so you can put your face back down like this, but you're going to use your arms only. You need to have your lower back, this here, your pelvis, completely relaxed. Mine just popped just thinking about it. So you're going to be like this, and you're just using your arms. And you're popping, you're pushing that fluid forward. You do it 10 times. 1, 2. My butt is relaxed completely.
So you're just working on your back.
Yeah, you're just pumping this. If you engage your glutes, nothing's gonna. If you tighten your glutes up,
make it worse.
it's not gonna make it worse. It won't. The fluid can't go forward. You'll feel it. Come on, let's try it. No, you just stay. You can just stay right here. You can use these pads, but at the house you're gonna use them. They're gonna be higher. Yep, and then just come up. Do it 10 times. Relax here. 1, 2, 2. Good. Don't engage this. 3. Focus here. 5. 6. Perfect. There you go. 7. 8. 9. And 10. Okay, when you're feeling that pain go down your leg, you can get in the floor in the therapy room or anywhere and do that exercise. You can do it anywhere. You're basically pumping the disc back that way. You're closing the hole a little bit so it pinches in the beginning. That's why you got to work up to 10. But when you're doing that, you're actually pumping the disc forward. This is the disc. It's gelatinous. It has fluid in it. When you're doing that, you're pushing it forward. When you sit,
You're doing that. Okay.
it squeezes it out the back way.
Okay.
Right now, you are completely blocked right here. So this is doing double time. It's irritated. So some of this is irritation. Going in between places here. How are you feeling?
Which windows?
Those over there. Look down for me. Lower that down to just there. Okay. Not bleeding. She's fine. You want to take a picture of it for her?
What does the scraping do? I like heard so much about it and
Well, what does it feel like?
scraping.
It just feels
Like I hear a bunch of like little balls. It just feels like a comb that you do this.
exactly.
Okay.
It's like a comb. And we're combing through adhesions.
Oh.
Yeah, that's the good stuff.
Yeah. Really?
All right.
Are you ready to see it?
Yeah.
Yeah, all that was going on back there.
Wow.
Oh, that's a nice one. But that's that spot that was locked, right?
Yeah. That's the region I'm telling you.
That's so funny. 'Cause
T12.
if people see that, like, oh my gosh, you got beat up, that even hurt. Like,
No, it doesn't.
and is it inflammation? And it
comes out. It's metabolic waste. So the tissue can't flow. The blood can't flow in those tissues.
wow.
And so then when I scrape over it,
Mhm.
it comes to the surface. Eventually, you get it done enough, nothing comes out anymore.
Okay.
It just, you clean it all out once
And
you get it smooth.
And what's the difference between that and cupping?
Cupping is more like, it's just another way to move the tissue.
Okay.
So cupping, we're pulling the tissue. Scraping, we're combing it. It's just mobilization, moving it. Now, elbow back. Good. That's all let go. Sit up as straight as you can for me. Now we should be able to do that. That's the loose one that you were clicking.
And then this one,
The tight one, right. So,
just like the knee.
right. The shoulder is sitting forward on this side.
Mm-hmm.
So you have to be able to tuck it down. The scapula, your lats. You have to engage your lats and pull it down. It's going to be harder on that side. Yes, kind of. but it's gotta be. That's why I keep squishing this down. It's unnatural because your body's shaped that way, your spine.
I'm trying to hold it, and
It's not a big deal. If it doesn't go, it doesn't go. How important is the shoulder to move? Not that important. Okay. And not unless you had something functionally wrong with it, which you don't. It's just mobilization, getting stuff moving, unlocking segments. It feels good. Get blood flow in there, lubrication. You okay? Does that hurt a little bit?
like over here.
I know. This right here. Like, I don't know.
Why?
I don't know. It's all flexed forward. The joints are like popped this way. They're forward, so I'm trying to.
Like my wrist does that.
The metacarpals, that were to right here, are lifted forward. Really hugging that mouse. I don't know. Really gripping it.
I stopped playing the flute at church because it was hurting so much here. And the piano, like, I don't know.
That might be. I think that's your neck.
Really?
But.
And it goes all the way down?
Oh yeah, this is the opening here. That's where it comes from. But yeah, it's just so sore already. It's kind of like it's tapping out on me. You need a lot. You gotta bring that down. When you do this, you pinch it, open it.
Like I need to relax.
Yep. Okay. We all do this.
We're all anxious, nervous.
The neck I'm not as worried about. It just needs work.
Mm-hmm.
It just needs to be worked on.
And do you think I should do like stretches?
Yoga. You can always do yoga. Like a nice yoga class, Bikram yoga, if you've ever heard of that. Hot yoga or something like that would help you. Yeah, get you moving. Get the blood moving. Okay.
No impact.
Not on
no
that low back.
running.
Not for a good couple months.
I mean, I hate running anyway.
I know. I don't mean to like not. You can do the elliptical.
Mm-hmm.
You can do just non-pounding. Jump rope.
Bike.
The bike. I don't like the leaning forward.
Okay.
You haven't really learned yet, and then the raising of the shoulders.
Okay.
Like if the bike was upright or something, like an elliptical machine,
Okay.
or
Walking is good.
walking. You can walk as fast as you can. That's almost the same as running. Burns a lot of calories.
What else? I think that's it.
Yeah. I mean, if you have any other questions, you can always ask us. Like, if you're like, hey, what was that you said?